Christian Bryant. Same host, same shirt, but the quality of our shows keeps going up in size, just like my clothes during the pandemic. Here's what we got for y'all. We've almost made it to the 2-year mark of the pandemic, and there are still a lot of things we're trying to figure out, like effects of long COVID. Millions of Americans are estimated to have long COVID symptoms that last months or years. And while we're working to understand how it impacts the body, we're learning more about how it impacts your wallet. One study found that more than half of US adults who got COVID or lost income during the pandemic struggle with medical debt. This has forced some people to dig into their savings, but that's not all. Medical debt has led to lower credit scores, and it can make it tougher for some folks to pay for basic necessities. So when people have long COVID, they often rack up fees from appointment after appointment that could put them behind on their medical bills. That's because insurance companies won't always cover long COVID treatments. Over the last year, the CDC has created medical codes for a lot of COVID symptoms, but many symptoms of long COVID still don't have one, or they're complicated to categorize. And when that's the case, an insurance company might decline to pay.
I think they developed 159 new codes to try to deal with post-COVID stuff. And that, if you don't have a code, you can't submit a claim. And if you don't submit a claim, you don't get paid.
Insurance companies also want proof the treatments work. And without that, they might say it's not a medical necessity. It's a concept Linda Berkthold has studied for 30 years and conducted research on at Stanford.
So the term medical necessity then became a way for an insurance company to say, well, you may think it's medically necessary, Dr. X, but our research and our clinical policies show that this is not necessary for your patient. And sometimes they explain the reasons and sometimes they just deny it.
In December of 2020, Congress approved over $1 billion of funding for the National Institutes of Health to research long COVID. Since then, the NIH has set up studies like their Recover initiative.
There are clinics around the country that are treating patients and collecting data. But for those patients who are trying to get coverage right now and being denied, it's a tough war for them because the data isn't in and they have a hard time proving their case.
A lot of these people are not only left with debt, but some are unable to work, putting their income and their work-sponsored health insurance at risk and adding more stress to their financial situation. New data from the Brookings Institute shows that there may be a connection between the labor shortage and long COVID patients. One study of patients with long COVID found that 23% were out of work due to their illness, and a separate study found that 28% were unable to work. Brookings found that potentially over 1 million Americans are not working due to long COVID at any given time. But this also doesn't account for people who've had to cut back their hours, start working part-time, or take a demotion because of their sickness. And for someone who's already not feeling well and trying to balance their new lifestyle, that can make it even harder for them to take on these battles with insurance companies.
I would say you get a denial, or your doctor gets a denial and tells you this has been denied. You fight that. You actually go back, you have your doctor help you, go back to the insurance company and say, exactly what criteria did you use to deny this?
We've explained the struggle of getting insurance companies to cover long COVID treatments, and now we're going to talk with someone who has experienced this firsthand. We have with us Camille Buckner, a psychology professor who got COVID in March of 2020 and is still recovering. Camille, thank you so much for chatting with us.
Nice to be here.
Can you tell us a little bit about the long COVID symptoms you're getting treated for, and what it's been like getting insurance to cover those treatments?
Like I have trouble breathing, regulating my breathing. Like sometimes I just stop breathing, and like regulating my temperature. Like I get ice cold and I can't warm up kind of stuff. And then cognitively, my symptoms are poor focus and attention, like channeling my attention. I think my problem has a lot been access to doctors that will go along with prescribing me medications and treatments that are really kind of in the experimental stages. Now, how that relates to insurance is that the insurance companies, it's hard to separate insurance from medical practice, right? Because the insurance companies kind of govern a lot of what doctors do and can do, which is unfortunate, but I just haven't found doctors willing to, that take my insurance, willing to kind of give me access to the treatments that are coming out. So I tried and tried and tried. For almost 2 years, I was trying to go through my insurance to get treated. And I did spend a fair amount of money that way. Even, with insurance, you can still spend a lot of money. And I haven't gotten treatments.
How is the extra stress of figuring out how you're going to pay for these treatments, how has that impacted your overall well-being?
It's pretty stressful. I mean, I'm doing okay. It's just a lot. Like it's hard to be chronically ill. Like it feels terrible. And then to have like cognitive dysfunction be part of it. And then to have to figure all this stuff out. And then to have to wrangle with insurance companies. It seems like a lot of extra on top of something that's not so good in the first place.
How has all of this affected your ability to work?
Work has been really hard. So, March of 2020, this hit everyone, and then things went virtual. So I don't know how I survived the rest. We were mid-semester, spring of 2020, and somehow I managed the rest of the semester. I was mostly in bed, and I would just kind of like crawl to my desk to get on Zoom and teach. By September of 2020, I was approved for short-term disability. And so that allows you to get a portion of your pay and have I had until December off. So from August to December, I had off, and I returned to work in January of 2021. And it was very, very difficult, that spring 2021 semester.
Camille, thank you so much for sharing your experience with us and helping us understand long COVID a bit better. We appreciate it.
Thank you.